Guideline Central. My name is Dr. Tabitha Michaud, and today we're talking noses with the Joint Task Force on Practice Parameters 2022 guidelines titled The Medical Management of Chronic Rhinosinusitis with Nasal Polyposis. So the Joint Task Force is what we'll call them from now on, but they're comprised of the American College of Allergy, Asthma, and Immunology, as well as the American Academy of Allergy, Asthma, and Immunology. But from this point forward, we'll just refer to them as the Joint Task Force. And they wrote this guideline with the intent of providing updated treatment recommendations for patients over the age of 18 with chronic rhinosinusitis with nasal polyposis. But for the rest of the video, we're just going to refer to it as CRS. Now on our website at guidelinecentral.com, we have a couple of resources that are great for this guideline. If you're looking for the full text link, we have that there, as well as the guideline summary and a pocket guide that's available if you're looking for a quick reference version of these guidelines. Before we get too far into this guideline, we're just going to go over a couple of acronyms just to make sure we're all on the same page about what we're talking about. The first one being chronic rhinosinusitis with nasal polyposis, that we'll just refer to as CRS from this point forward. There's also INCS, which is intranasal corticosteroids. And lastly, aspirin exacerbated respiratory disease, which is referred to as AERD, and asthma therapy after desensitization, also known as ATAD. So the purpose of this guideline was to evaluate the current evidence and provide guidance on the use of INCS and biologics for patients with CRS and the use of ATAD in patients with AERD. Now do keep in mind that the current evidence for the use of surgery in patients with CRS was not evaluated, nor were other management options besides INCS, biologics, and ATAD. So this guideline was developed using the best practice recommendations from the Institute of Medicine and the Guideline International Network, and recommendations were graded and assessed using the grade method. And that means for each of the recommendations, there will be both a strength of recommendation, which will either be strong or conditional, as well as a certainty of evidence grading of high, moderate, low, or very low. And with that, we have 3 recommendations from the Joint Task Force on CRS with nasal polyposis management. So let's get into the guidelines. Our first recommendation from the Joint Task Force is a conditional recommendation with a low certainty of evidence. And here, the guideline panel suggests that clinicians use INCS rather than no INCS for patients with CRS. However, it is worth noting that the network meta-analysis linked to this guideline does include a potentially important note about the method of delivery for the INCS treatments. So there are a couple of different methods for delivery for INCS, such as INCS stint, spray, and exhalation delivery system, or EDS, are among the most beneficial of the INCS delivery methods across multiple patient-important outcomes. And so we'll look at this and some of those outcomes that we're talking about a little bit later in this video. Our second recommendation from the Joint Task Force was a conditional recommendation with a moderate certainty of evidence. And here, the guideline panel suggests that biologics, rather than no biologics, be used for patients with CRS. Now do keep in mind though that there is some variability in terms of the efficacy in biologics that may impact your overall choice. And so we'll go over a little bit of a comparison of biologics in just a little bit here. Our third and final recommendation from the Joint Task Force was given a conditional recommendation with a moderate certainty of evidence. And here, the guideline panel suggests that for patients with AERD, they should be treated with ATAD rather than no ATAD. It's important to remember and consider some of the risks when performing an aspirin desensitization test, such as if a patient has severe, poorly controlled asthma. Also keep in mind some of the risks that impact the safety of long-term aspirin use, such as treatments or conditions that cause increased risk of bleeding. Now that we've wrapped up the recommendations from the Joint Task Force, let's take a look at some of the comparisons for INCS and biologic treatments. For the INCS comparisons, the guidelines assess the INCS delivery mechanisms: stints, sprays, rinses, enhanced delivery systems or EDS, and drops, and then labeled these INCS delivery systems based upon their characteristics. So in terms of improving the overall quality of life, both the rinse and EDS categories got a yes. And for symptom improvement and reduction for the potential need for surgery, stints, sprays, and EDS got the yes. And those same 3 delivery systems, the stints, sprays, and EDS, all got the same yes for smell improvement with the addition of drops as well. Now let's compare the biologics. So similar to the INCS treatments, the biologics were categorized based on their characteristics. So for these biologics, we're going to be looking at dupilumab, omalizumab, mepolizumab, and benralizumab. And these are actually also put in order from the most efficacious to the least efficacious for their given characteristics. So first, for the quality of life improvement, dupilumab was first, followed by omalizumab, then mepolizumab, and last was benralizumab. Now for symptom improvement, the order was the same. However, benralizumab was not included on that list at all. Now in terms of the reduction for surgical need and improvement in smell characteristics, first was dupilumab, second was mepolizumab, and third was omalizumab. And for the reduction in need for oral corticosteroids, first was dupilumab, second was mepolizumab, third was benralizumab, and omalizumab was not included. And that wraps up our quick reference review of the 2022 guidelines from the Joint Task Force on the medical management of chronic rhinosinusitis with nasal polyposis. Now, of course, this was just our quick reference bird's eye view approach of the guidelines. So if you're looking for more information about these recommendations, including the evidence behind them and tables comparing INCS treatments and biologic medications, you can find the link to the full text guideline on our website at guidelinescentral.com, as well as the guideline summary and our available pocket guide for this guideline. While you're there, make sure to check out our hundreds of clinical practice guidelines from over 45 different medical societies, and we'll see you on the next guideline.